Regarding the Rultract Xiphoid rakes, the type of rake is determined by the patient's anatomy as well as the surgeon's preference. We have a variety of different Xiphoid rakes. They are all designed to go into a small incision, sub-xiphoid incision. As you'll see here, there is a two-prong hook. Has a very low profile with some space in between the two prongs to provide added exposure and visibility. We have a shorter, more robust style hook. It's designed for, I would say, a heavier chest, although the hook is actually pretty shallow. And it's also thicker, so some surgeons say that it actually hinders visibility. Another very common used xiphoid rake is a 73, I believe. As you can see, this is significantly longer to go further up underneath the xiphoid to create the tunnel. And something that we recently made, it's long and narrow. It does get significantly more under the xiphoid. Also has a more pronounced bend to help lift straight up. This is a 79. And then something else that we recently developed for resternotomies that are used, that's used at a sub-xiphoid incision as well, is what we refer to as the Resternotomy Assist Retractor. The Resternotomy Assist Retractor comes in actually comes in three different size rakes, but as far as adult patients go, you have a 12 millimeter and an 18 millimeter sized hook or rake. The way this is designed to work is it would go in a larger sub-xiphoid incision. A larger incision because you're going to go on both sides of the costal margin with this retractor, as opposed to the sub-xiphoid hooks or rakes. You go directly under the base of the sternum. And here we are going on each side of the costal margin, so the incision has to be larger. Once you make the incision, you put the retractor in place. Go ahead and elevate the incision site. You would gently elevate the sternum at the xiphoid incision 1 millimeter per click when you turn the retractor, as to not tear any of the adhesions. Once you are able to gain enough exposure to begin your dissection under the sternum, you can continue to lift the sternum, and once you achieve enough elevation and cut away enough of the adhesions that you feel that you're able to dissect down through the sternum to begin your dissection here, once you are clearly through the sternum at this point, you would turn the thumb screw and this is designed to actually help spread the dissection of the sternum. As you'll see here, if I could zoom in on this. So you'll see it starts to actually spread this area. And then as you continue to dissect down toward the manubrium or up toward the manubrium, you can reposition the resternotomy retractor along the line and continue to elevate and spread as you dissect. So it's very effective. It's used at some of the largest children's hospitals, and it is also being used now in a number of adult centers as well for redo surgery, for redo valve surgery. I just feel that this is more effective than our xiphoid hooks, because again the xiphoid goes directly under the sternum and elevates. This actually will elevate and spread as well. You would also mention wanting to use the Rultract for the resternotomy procedure. In order to do so, you would take your standard Rultract set and you would add the 6-inch extender bar to it. Of course, this extender bar will extend the retractor out over the center of the patient's chest. Then you would take your ratchet assembly. Now we have removed the sternal rake plate from this. You would add the ratchet assembly to the top post. Something new that we have is referred to as a resternotomy retractor. This is designed to attach to our ratchet assembly. Goes down into the subxiphoid incision, and not only will it lift, but it will also spread the incision. So we lift and spread the incision.